Welcome. So in this video we're going to talk about the contraceptive injection counseling. So we're going to cover the important aspects or for you to be familiar with the counseling or for contraceptive counseling. So we're going to focus on progesterone depot injection, including the common questions patients ask and the answers will be expected to articulate and how best to structure the consultation. And actually this one even features in osce, and therefore it's important to be familiar with the various types of contraception available. So if you haven't seen the other contraceptive counseling tutorial, you can even check it out because it's the second one. Okay, so let's start with the opening the consultation. So of course, when opening the consultation, you have to wash your hands and do your own PPE if appropriate. Then introduce your name, introduce yourself to the patient, including your name, role, and also have to confirm the patient's name and date of birth. Then you have to check the patient's understanding of the types of contraception available, and you have to explore the reason why the patient wants the progesterone depot injection. So you have to know why is the patient wanting specifically this depot contraceptive injection. Okay, then you go to the ideas, concerns, and expectations, or ICE. So it is important to explore the patient's ideas, concerns, and expectations early in the consultation, as you may need to correct any misconceptions about the progesterone depot injection, address the patient's concerns when exploring concerns. Then it is also best to do so in a sensitive and honest manner. Then it's also important to clarify the patient's expectations of the progesterone contraceptive depot injection, because if these are unrealistic, other forms of contraception may be better able to meet their needs. So remember, you're doing ICE, so you're starting with ICE. I for the ideas, so for the ideals, so ideas, sorry. So ideas, how to explore what the patient's current understanding about the progesterone depot injection, so that we have to assess the patient's ideas. So have you heard of the progesterone depot injection? Okay, so what do you already know about the progesterone depot injection? Then after you're done with the ideas, then go to your concerns. So ask if the patient has any concerns about the progesterone depot injection. So is there anything that worries you about the progesterone depot injection? Go to expectations. So explore the patient's expectations of the progesterone depot injection. So what are you hoping the progesterone depot injection can do for you? Then the other way you can ask is, why do you think the progesterone depot injection is the best choice for you? So those are some of the questions you can ask for to assess the patient's expectations. Okay, then we go to what is the depot injection. So using the patient-friendly language, you have to explain that the progesterone depot injection contains a hormone called progesterone. So the progesterone depot contraceptive injection contains a hormone called progesterone. So that's how you begin. So you say this hormone is almost exactly the same as your natural hormone that is produced by your ovaries. So that's how you explain what the depot is. Then you go to the types of depot. So you say the main types of depot injections available. We can have depot Provera, which is the most common. Then we can also have Cyana, press. Those are some of the types of other depot injections. But of course, there are also others. Okay, so how does the depot injection work? So you have to explain that the depot injection works by inhibiting ovulation, thickening cervical mucus and lining the lining and thinning the lining of the endometrium, making it difficult for a fertilized egg to implant. So how are we going to explain that to the patient? So we're going to say, so this depot injection works by preventing your ovaries from releasing an egg every month. It also causes thickening of the mucus at the entrance of your womb, which stops the sperms from moving through it. Then lastly, it thins the lining of your womb. So even if an egg is fertilized, it would not be able to implant. So those are some of the things we explain. Okay, so you go to how effective it is. So you say uh, the patients. So the patients always want to know what a contraception is, and this is often a major factor in their decision as to which type of contraception they want to use. So it's important for you to know basic statistics on efficacy. So you have to go through the Pearl index. So however, if you are unsure, signposting the patient to a reliable source and you don't have to guess. So signposting is a very important aspect if you are dealing with counseling or just dealing with a viva question. If you ask the question you don't know, you can just signpost them, especially if they're asking about how effective these contraceptions are. So the depot injection is 99% effective. Then if you you tell the patient to say, if you have your injections at the right time, then the depot injection is 99% effective. Okay, so what are the advantages and disadvantages? So always you have to give the patients as much information as possible so that they can make an informed decision. Then it is useful to do this by discussing the pros and cons of the progesterone depot injection. So you tell them to say, if it is okay with you, I would like to tell you about the benefits and the disadvantages of the depot injection. Then hopefully you will have enough information to make a decision. Then you go to the advantages. We starting from the advantages. You say one, they are long-acting contraception. So you say, we tell the patient the depot injection is a long-lasting contraceptive method. So this means that you don't have to think about contraception for as long as the injection lasts. Okay, then you go to how effective. So the depot injection is 99% effective when administered correctly. So if it's a depot Provera they want to start with, you can even tell them to say, okay, so this one you have to be giving you every after 3 months, then you have to be coming at the right time when we give you. Okay, then you also have to tell them that it's not associated with ovarian cysts. So unlike some other contraceptive methods, the depot injection is not associated with ovarian cysts as it prevents ovulation. Okay, then the other advantage is that it is they are less painful periods. So your periods may become less painful. So those are some of the things. Then you say useful if estrogens can't be taken. So the depot injection is useful if you can't take estrogen containing contraceptives such as the combined oral contraceptive pills, the COCs. Okay, then the last disadvantage you can say, it is safe during breastfeeding. So the depot injection will not harm your baby if you choose to breastfeed. Okay, then we go to the disadvantages. So disadvantages, you can say the side effects to start with. So we start with the side effects. So we tell them that you may experience some side effects such as headache, nausea and acne, mood changes, and breast tenderness. So some of the side effects. Then tell them that there will be change in periods. So when you take the depot injection, your periods may change and you may experience irregular, light and more frequent periods. There is also a chance that your periods may last longer and become heavier. Those are some of the things you have to tell them. And then the other is protection from STIs. So remember, it doesn't protect from STIs. So we tell them, unfortunately, the depot injection does not protect you from sexually transmitted infections. Hence, of course, if you're unsure of the status of your partner or of the sexually transmitted infections, other sexually transmitted infections of your partner, you have to use condoms. And then you go to the weight gain. So this depot most likely can cause weight gain. So you tell them, so okay, so for depot Provera and the cyanopress, They are associated with weight gain, and especially if you are under 18 and have a high BMI before starting the depot injections. And then, of course, the most important part is fertility. So we tell them to say after stopping the depot injection, there can be up to a 1 year delay before your fertility returns and you are able to become pregnant again. So this is the important aspect for you to tell the patient this. Okay, so what are the risks of the depot injection? So the risks are that you have to explain the risks of the depot injection so that the patient is aware and can make an informed decision. So one risk is osteoporosis. So the depot Provera or Sayana press may cause thinning of your bones. If you are at a higher risk of developing osteoporosis, maybe due to long-term steroid use or family history of the condition, then we would normally advise you to choose another type of contraception. That's how you tell the patient. Then for breast cancer, again, you tell them to say, okay, research shows that there may be a very slight increase in the risk of breast cancer if you use the depot injection. Then go to the last risks is infection. So tell them, say, okay, all injections come with a very small risks of infection. In most cases, this could be easily treated with some antibiotics. Then for contraindication, so it's important to talk about contraindication. So we tell them a patient should so we tell them to say there are some contraindications that I'd like to tell you. So you shouldn't take this depot Provera if you are either pregnant, thinking of becoming pregnant within the next year, have breast cancer, have severe cirrhosis, have liver tumors, or have a history of severe arterial disease, or have risk factors of osteoporosis, or experiencing unexplained vaginal bleeding. So those are some of the contraindications. Then, so how is the depot injection given? So if it's the depot Provera can be administered into the muscle, often via your buttocks or the side of your thigh. So that's what you tell the patient. Then if we are explaining the Sayana press, just tell them, say, okay, the Sayana press is injected beneath the skin via the front of your thigh or abdomen, and some women can be taught how to administer these injections themselves at home. Okay, so that's all on the depot. So now closing the consultation. So we have to summarize the key points back to the patient, and you have to ask the patient if they have any further questions or concerns that haven't been addressed. Then throughout the consultation, you should check patient's understanding at regular intervals. So let's say you finish explaining how the depot Provera works, you have to tell them, okay, you can use even phrases such as, can you just repeat back to me what we have just discussed regarding if it's how they work, regarding if it's the main types that are available, if it's regarding something you want them to remember. Okay, then it may also be useful to direct the patients to any websites or leaflets with further information. Then you also have to offer the patient time to consider their decision. You have to encourage the patient to use condoms if they are not currently using contraception. And then, of course, you have to thank the patient for their time to dispose of the PPE appropriately and wash your hands thereafter. Okay, then finally, what are some of the common patient questions? So there are some common questions that may be asked regarding the depot injections. Also, sometimes in an osce situation, especially with the introduction of Alex, they may ask you one or two questions at the end of the consultation. Having a good answer can demonstrate to the examiner that you have a solid understanding of the topic. So the number one question they can ask is, when can the patient start using contraceptive injection? So you answer to say, so the patient can start using the injection at any time of their menstrual cycle, as long as they are not pregnant. However, if they start on any day other than the first 5 days of their period, they would need to use condoms. Then the next question they can ask is, what should the parent do if they want to try and become pregnant. So you say patients are usually advised to omit further injections once they have decided they want to become pregnant. There can be up to a 1 year delay between stopping the depot and normal fertility resuming. So don't forget to advise the patient on pre-pregnancy care, such as the folic acid and smoking cessation, because those are important. Okay. Then the last question maybe they might ask is, can the patient restart depot injection after having a baby? So patients can restart the injection. That's what we tell them after having a baby. If the injection is started after day 21, advise them to use condoms for 7 days. Okay, so those are some of the things we'd like to answer, and that's the end of the tutorial. Thank you for watching, and if you haven't watched the other one on implants, the contraception, the counseling on implants, please check out the video and like the channel, and thank you for watching. See you on the next tutorial.